All right, so I am going to go ahead and start recording. Once again, thank you all for joining us this evening. We're very excited to be able to collaborate with the UNC Hispanic Dental Association and UNC School of Dentistry. So in order to start us off, let me first share my screen. Okay, so it's a very quick, brief introduction to the Pulso program. Minimize this. Perfect. All right, so our event tonight is in collaboration with the Carolina Latinx Center and the Pulso Scholars Program. Currently, our applications are open. If you have not heard about the Pulso Scholars Program, please head to our website and read a little bit more as to what we do and what our purpose is. But very briefly, the Pulso Scholars Program was started in 2017 to serve as a pipeline program for undergraduate students from underrepresented backgrounds interested in going into medical school or any other type of health professional school or graduate school, and just giving the students some experience, including physician shadowing, cadaver lab tours, mentorship, and other programming throughout the years and their time at UNC. Like I said, the applications are still open. The deadline is tomorrow. The application is very short. So if you're interested, feel free to check us out. And I wanted to share, before I hand it off to Jonathan and Arlet, I wanted to share with you all that next week we're going to have another student panel with the medical students at UNC School of Medicine called Taking a Gap Year. And that's going to be next Wednesday, April 15th at 5 p.m. If you're interested, feel free to send us an email or send myself an email here at pulsoscholars@gmail.com, and I can share with you that information for next week's Zoom meeting. So with that, I'll stop sharing my screen and I'll hand it off to our hosts or our guests. All right, should be good.
Okay. Let me just pull up. Okay. Hello, everyone. I'm Jonathan. Can you guys hear me?
Yes.
Yes. Okay. So yeah, we're just gonna talk about the UNC Adams School of Dentistry. I'm a third-year student. Arlette, who's with us too. She's a first-year student. And if at any point you guys have questions or anything, feel free to use the chat function or just ask a question on your mic. Let's see. All right.
All right, I guess it's my turn now. Hello, everybody. My name is Arlette. I'm a first-year dental student at the Adams School of Dentistry. Currently, my position in HDA is historian. I basically take care of the social media, make sure I'm in contact with you guys. My hometown is Miami, Florida. I'm originally from Cuba, but this is where my family is right now. I went to Florida International University and I graduated with a degree in art history with a minor in biology. So if you have any questions about what it was like for me applying without having had a science major, then I can definitely help you with that. And in terms of what my plans are for after I graduate dental school, I don't know yet. I still am trying to figure out what I want and taking it day by day.
Okay. All right. So for me, like I said, my name is Jonathan Solares. I'm a third-year dental student. Current role is a co-president. Christian Glacken, who's also a third year, is our other president. My hometown is Morrisville, North Carolina, so about 30 minutes away from Chapel Hill. I went to UNC also for undergrad, graduated in 2015 with a major in biostats and a chemistry minor. My plans after dental school, so dental school is a 4-year program, I have a year left, is either do an advanced education in general dentistry or a general practice residency. It's basically a one-year program to refine your skills, work on more advanced procedures that you don't necessarily get exposed to as much in dental school, like implants, grafting surgeries, things like that. Okay, so what is HDA, Hispanic Dental Association? It was established in 1994, aimed to provide a continuing education for oral health professionals, serving the Hispanic community, and stimulate interest and encourage entry of Hispanics into oral health professions, and also outreach to the growing Hispanic population in the US. What do we do specifically? The UNC chapter of HDA, we have we collaborate with Vidas de Esperanza. They're a nonprofit organization where we have our Vidas de Esperanza dental clinic. It's a free clinic in Siler City, North Carolina. If you haven't heard of Siler City, it's a predominantly Latino population. The majority of our patients do not actually speak English, so that's a great way, or we found that clinic as a mutual interest of ours. Great way to practice your medical, your dental Spanish, and it's a great outreach program that we're super excited about. We also have lunch and learns. We bring in dentists from the area. They speak about their experiences and their specialties. We had a periodontist who specializes in gum procedures come and talk about his practice. We also have conversation cafes, which is an opportunity for us to just learn medical terms in Spanish and to just work on our Spanish. We have coffee and pastries. We do those once a month. Volunteering at health fairs and social events like salsa nights and things like that. And the annual national conference, which you see a picture of us in the bottom. This year was in LA, and next year I believe is in Philadelphia. And we were lucky enough to have the school fund, 6 of us to go this year. So that was great.
Okay, so now we're just gonna go over a little bit of what the requirements are when you're looking into applying to dental school. So every school is different. Generally, what they require is general biology 1 and 2 with the labs, general chemistry, organic chemistry, biochem, physics, and English, obviously. But just make sure that you know that UNC requires human anatomy and physiology, which is something that some schools have different requirements. Some of them don't include it. Some of them have microbiology as a requirement as well, excuse me. Something else that you probably know that you should be doing or thinking about doing in the future is taking the DAT, the dental admissions test. It's scored from 1 to 30. I think that the natural average is usually around a 17 or an 18.
Yeah.
There's different ways that they score the test. There's like an academic average, the perceptual ability, there's the natural science portion, quantitative reasoning, and reading. It costs about $400 to take the test. You have to find a testing center around you that provides it. And you need to do that in advance, usually a couple months in advance, because it usually fills up pretty quickly. Something else that you should know that you need when you're applying to dental school is 3 letters of recommendation from your science professor, someone from your major, and as well as a dentist. Usually looks really good as well. And all of that documentation plus additional information are submitted through ADSAS, which is this platform online where you upload your letters of recommendation and you fill out the application. It's somewhat extensive. Okay. All right, so just a little bit more about our student profile at UNC. The average age is usually around 24. We have a wide variety of students in terms of where they come from in the state of their life. Some of them are married, they have children. The youngest person in my class is 18 years old. So it's a really different experience from college when you come into into dental school or any graduate program, you have a huge variety of people that you're going to interact with. The division in gender is really good. We're almost 50-50 in females and males. In terms of ethnicity, it's predominantly Caucasian. Around 14% is African American, 6.5% is Hispanic, and then we have a little bit of American Indians and other ethnicities as well. In terms of GPA, it's usually a little bit higher for out-of-state students, but the average is around 3.6. As you can see, the DAT is around a 20 for perceptuality and 21 for DAT. Also, all these stats are usually a little bit higher for out-of-state students, but that depends on you and where you're coming from.
And what UNC really wants to stress with these statistics is that a lot of students fall either above or below these ranges. These aren't hard set numbers. So if you feel like you don't necessarily fit within one of these categories, don't be discouraged at all. The way UNC kind of looks at it is where you're headed to or where you're going is just as important as where you've been already. So yeah, don't be discouraged by these numbers if you don't feel like you fall within the range.
Yeah, it's an average for a reason. There's people above and people below, and most of the time the numbers don't really correlate to the kind of clinician that you're going to be or the kind of dentist. So don't, like Jonathan said, don't be discouraged from applying if you don't hit that mark. It doesn't really matter that much.
All right, so like we said in the previous slide, our Let's class is around 6.5% Hispanic Latino, and it actually next year it grew to 10%, which was very exciting news to hear for us because it does more closely represent the Latino population in North Carolina. Cost of attendance, it varies slightly from each year. Each year's tuition and clinic fees is different, but rough averages are $58,000 for North Carolina residents and $100,000 for non-residents.
All right, so ways that the school is trying to improve or diversify our student body is by allocating some resources to helping students from underrepresented backgrounds and with financial need to be able to attend our school. Around, like you can see in the presentation, there's a lot of money that's given each year by the North Carolina Dental Foundation that helps us, helps the school, helps students become part of our student body. And here are some ways that you can pay for dental school because it's very expensive. The Dental Foundation of North Carolina has a lot of scholarships that are given each year. It's a really good thing that the school just has one single application that you fill out, and then they apply. They see more or less what you qualify for, so you don't have to be applying to specific scholarships to kind of screen you from a single one. The financial aid scholarship, there are other scholarships that are given by the school. There's also loans, which most people use to fund their education. And I feel like there are other resources if you click to the next slide, Jonathan. Yeah, there's also the scholarships given by the Army, the Navy, and the Air Force. It's called HPSB. I think it's Health Profession Scholarship Program. So what it is you apply for it's very competitive, but you should be thinking about applying before you start dental school. There are 4 years and 3-year programs, and basically how it works is that they pay for your education completely, all of your tuition and fees, plus they give you a stipend. You will be, I think, a captain when you start because of the level of
In your
education.
education. Mhm.
And after you graduate, then you would have to pay back those years by working with whatever branch of the military you signed up with. Um, so if you signed up for the 4-year program, then you would have to be stationed with whatever branch you decided to go with for those 4 years. Also, if you are thinking about specializing after dental school, they have their own programs for that as well. So if you wanted to go into oral maxillofacial surgery or periodontics, orthodontics, then you'll be able to do that through the military as well.
Mhm. Okay, other sources of funding, Indian Health Services. So in this case, you would graduate from dental school and you would work at an Indian Health Service clinic, and they would pay back a portion of your loans, and that would be determined in your contract. And then the Health Service Corps, this is something you apply for during dental school. It's similar to the military scholarships in that you get somewhat to decide where you're assigned to, but you would work in a underrepresented area or an area where a lot of people have barriers of access to care, and lower income areas as well.
Okay, so I guess this is me right now. So I'm first year. So this is just a little bit of an overview of what dental school would be like curriculum wise and how to navigate each year or how we felt about each year. For me, it's only first year because that's the only thing that I've done so far. So in terms of credit hours, it is much more rigorous than what you're probably used to. I think during college, I was probably taking no more than 12 or 13 credit hours each semester, and it went from that to 20, 22 credit hours. But, it's just something to keep in mind. I probably feel like you have heard other people say that it is pretty rigorous. So first semester would be fall. First year, you'll be taking dental anatomy, which is like the biggest class of the semester. You'll be obviously learning about teeth or morphology, how they, like the sequence of how they erupt. You're going to be in lab a lot too. You're going to be doing waxing, which is also going to help you understand the morphology of teeth. You're going to be taking human anatomy, gross anatomy, and you're going to be in dissection lab, which is pretty, I'm not going to say fun, but it's very interesting. I think that was one of the highlights of the semester. I feel like it's a little bit of a rite of passage for most of us. Then we take a class that I feel is kind of follows you throughout dental school, is practice of dental medicine, and basically just teaches you how to be a clinician. We have patient encounters where you learn how to take a history, how to do a head and neck exam, how to take blood pressure and stuff like that. So I think that it's really nice because it makes you feel like you're actually in a healthcare profession, and you take a break from all the didactic courses that you're taking. And then we do a little bit of conservative operative dentistry, which is how to use a handpiece and doing perhaps just like drilling on teeth, basically. And then on spring, we do more of conservative operative dentistry. I think that's the biggest class of the semester as well. We do human physiology, microbiology with the lab. Yes, we do streaking and we do gram stains. We take karyology, which is understanding one of the most prevalent diseases, which is dental caries, how they develop and how to detect them. And in the summer, then we move on to radiology, pathology, and a little bit more of perio.
All right. So I'll go ahead and talk about the second year of dental school. This is typically when you'll start seeing patients. Your first patient, you're going to be doing a cleaning on them, and then you'll get phased into doing cavities and fillings, things like that. But for your fall semester of your second year, You'll get introduced to pharmacology, so like different kinds of medications, hypertension medication, diabetes medications, introduction to periodontal therapy, which is gum grafting, working more with the gums and not as much with the teeth. Fixed prosthodontics, so anything that stays in the mouth, like a crown. That's where you learn how to drill teeth to make crowns. Treatment planning, so the making of a treatment plan for a patient. You know, will they need a cleaning? Will they need fillings as well? Will they need some prosthodontic work? And things like that. Medical emergencies and local anesthesia. This is where you learn how to give injections, how to anesthetize patients, and Arlette will soon find out that you actually work on your classmates, and that's how we learn how to give anesthetic blocks. And then, yeah. And then in the spring semester, you'll move on to pharmacology 2, fixed prosthodontics, multi-unit. So this is more like bridge work, so multiple crowns, removable prosthodontics 1, so dentures, biomechanics and preclinical orthodontics, so you'll get introduced to orthodontics like braces, and then clinicals, this is where you'll be seeing some of your patients. Summer semester, preclinical endodontics, so root canals, learning how to do root canals, just the theory of it, you're not in lab yet. Removable prosthodontics 2, so this is partial dentures, patient management, and clinicals, so you'll be seeing more patients. You see more patients as the semester goes on, so say in the fall semester you might see 1 patient a week, and then you'll move on to 2, 3, so on and so forth. Third year of dental school, in the fall semester, you'll get advanced operative dentistry. So it's a continuation of conservative operative dentistry that you took in your first year, but this is where you're learning more advanced procedures like veneers, fundamentals of teeth whitening, things like that. Advanced concepts in periodontology and implantology. Dental implants are becoming more and more popular nowadays, so this is a really important class to know about and to take. Surgery, so getting introduced to oral maxillofacial surgery, even if you're not thinking about specializing in that area, it's still really important to know about those fundamentals. Radiology interpretation, learning about how to detect caries or cavities, pathology in the oral maxillofacial area with x-rays, and more clinic. In the spring semester, endodontics, so a continuation of root canals, TMJ and craniofacial pain, so anything that has to do with the TMJ joint, with the jaw joint, like right here. Practice management, more practice management, you know, learning how to be a better clinician, refine your treatment planning skills, things like that. And then in the summer semester, general dentistry and practice management. So as you can tell, it's not so much biology, microbiology. Now we're getting more into the dental classes. And then fourth year of dental school, you're pretty much you actually are in clinic every day. And in your fourth year of dental school, you'll actually be in 2 one-month rotations where you'll be doing dentistry, you know, full-time at a health center. So my first one is going to be hopefully in August, and I'll be in Kinston, North Carolina, working a full month, you know, basically 40 hours a week doing dentistry on patients. And then my second one will be in May or April, sorry. But for the fall semester of your fourth year, community and hospital rotations, I just talked about ethical and legal aspects of dentistry, general dentistry, and practice management. Some of these classes are in seminar formats, some are in lecture formats. Spring semester, critical thinking in general dentistry, patient management, and then no summer semester. You'd be graduating in May. Any questions at all about the curriculum?
I have a little bit of a comment.
Mm-hmm.
Obviously, I couldn't include every single class into this presentation that you take. It's a little bit of a disclaimer. You're going to be taking more classes than what is being shown here, and those can be seen on the website. But a little bit of a takeaway from this, and I think it's really cool, is that I think that the school does a really good job with specifically this class of patient, not patient management, practice management.
Mm-hmm.
Because a lot of students have been giving feedback that they felt like they weren't getting the preparation that they needed to transition into the private practice world, or just into the workforce, because they lack the skills of understanding the business side of dentistry, or understanding how to become a better leader in the practice for your team. So I think that right now we've already started patient practice management since fall semester, and we continue with the same professor. It's like modules that we take online, and we also have seminars throughout the semester so that we can practice and develop those skills as we're going through dental school as well.
Yep. Okay.
All right, so for student life, we have a lot of things going on. I think that whatever sparks your interest, there might be something there for you. There are a lot of organizations, including SNDA, the Student National Dental Association, ASDA. Everybody's a member of ASDA once you enroll in the school. They have a lot of different events throughout the year. That range from advocacy in dentistry, and you have the opportunity of attending different conferences throughout the year as well. Lobby Day, it's also very popular amongst their students. Student research group, and it helps you match with someone in the school that's doing research. They help you navigate how to find a lab, and basically how to manage your time while doing research and being in school if you're interested in doing that. There's sports dentistry as well, and there's also a social fraternity, DSD. There's a lot of different free clinics. We included a couple ones here. Obviously, Vida de Esperanza, the Dior Refugee Clinic, I think it's relatively new, right? I don't know.
Yeah, it's their first full year.
Yeah, I love that clinic. It's so awesome. They do a really good job there. Care Clinic is through SNDA. Samaritan Health Clinic. I've also been to that one. It's really nice. Wakebrook Clinic. I don't think I've been to that one, but there are a lot of opportunities for you to give back to the community and practice your hand skills and your patient management outside of the school as well through these clinics. And
Yeah,
also,
sorry, what's great about these clinics is that they help provide care to a lot of underrepresented areas. For example, DYOR Refugee Clinic, it's in the name. They help treat a lot of refugee patients. Care Clinic through SNDA helps provide care to a lot of African American patients. Care is in Durham. And Samaritan Health Clinic, they work out of the Durham Rescue Mission. And the Wakebrook Clinic works at a psychiatric hospital and works with psychiatric patients. So you get exposure to patients, from a very diverse patient population, rather.
Okay, do you want to talk a little bit more about research?
Yeah, so research is typically done after the first year, just because the first year, you're pretty busy with classwork and just getting adjusted to dental school in general. But after your first year, you can approach to professors if you're thinking about a specialty. Go to an orthodontics professor or oral maxillofacial professor. But most of them are really willing to work with you, and they're very flexible with your schedules because they know you're going to be really busy, and they're also really busy as well. But yeah, and it's really what you, let's see, I think do we have a question? Yeah. Oh, okay. I'll get to your question after this. So yeah, they're really willing to work with you. Let's see, anything else? It really is what you make out of it. So if you want to get into a project that's going to involve a lot of time, you can ask professors, do you think this will be, a very involved project, or if rather you don't think you have a lot of time, but you still want to get exposed to research, you can ask the professor that as well. In terms of free time, Arlette, do you want to talk about your experiences with free time as a first year?
It's definitely dependent on what kind of skills you're coming into dental school with. For a lot of people, including myself, it was a little bit of a shock because it is a lot of things to manage at once, a lot of classes coming at you. So for time management, I think that I'm still working on it, and I feel like it's something that I'm gonna continue on working on for the rest of my life. Um, I think that just understanding what the semester is going to look like beforehand, making sure that you have a calendar, making sure that you know when exams are, that helps you. I write out what the semester is going to look like in terms of exams so that I know when I need to start studying for that. Um, Let me see. For free time, I think it depends on how your study methods are. I take a very long time going through lectures and taking very extensive notes because that's how I learn best. I know some people have more free time because they're a little bit more efficient with your time, or they just don't study as much because they value their free time more. So I guess it depends. It depends on you, but there is definitely the possibility of being social, of going out with your classmates, of going out on the weekends and having a beer. I feel like first semester wasn't that bad. Like I feel like they kind of laid out the exams a little bit scattered throughout the semester. Like we didn't have that many exams in 1 week, so it felt nicer. This semester hasn't been that nice, especially with everything that is going on transitioning online. That has been a little rough, but there is definitely opportunities for you to engage with your classmates and have a social life outside of dental school. It just depends on how good you are with your time management. I'm not that great. I will admit.
And but as you progress in the program, second, especially third and fourth year, when you're seeing a lot more patients and you're a lot less of your time is spent in the classroom, you'll have more free time. Whether you want to, use that free time to volunteer at one of the free clinics we were mentioning, or take on research, or just, pick up a new hobby. I know I'm in my third year, so I was able to play, intramural sports again. That's something I didn't feel like I had enough time to do my first year, especially. So yeah, you definitely do have more free time after your first and second years. So it's not, it's not first year, but four, times four. Every year is different for sure. Time management, basically just know how you study most efficiently. It took me a full semester to realize that me typing out the notes for every lecture wasn't the best way for me, but rather kind of just like highlighting the notes that were already made, whether it's on the PowerPoint or, articles, things like that. Realizing that for me, actually listening to the recordings because every lecture is recorded. So actually listening to the lectures, I was able to retain that information a lot better than just reading it. So just kind of know what kind of learner you are, whether it's auditory, visual, or I can't remember the name of the one where you write, but yeah. Yep.
Yeah, I have another comment about that in terms of studying. I feel like after I took my DAT, I felt much more comfortable with sitting down for 5 hours and just studying.
Yeah.
Because of it, like forces you to do so. So I think that that's a good feel of how it's gonna be like. You're gonna be studying a lot, but also I think to like not push things to the last minute helps, to be proactive. And there's a lot of resources out there that are provided by your classmates, and you're big as well. We have a big little system where you get paired with a D2, which is a second year student, and they can help you with that as well. So yeah.
All right. So how pre-dentals can get involved. So UNC, they have an honor society called Delta Delta Sigma. I think you can go on this, just Google it, and there should be a page, and they should have their contact there. If not, email me, and I think I can get you connected with their president. They meet once a month, I believe. So that's a great way to get in contact with other pre-dentals, and they'll connect you with other resources as well. The Student National Dental Association has an Impressions Day where you you actually have to apply for it, and you come into the school on a Saturday. And you've worked with Impressions Day, right, Arlette?
Yeah, we just had it.
You can talk about it, yeah.
Yeah, we have a question on the group chat. We'll get to it after we finish talking about how to get involved, or after we finish talking about Impressions Day. So Impressions Day, you sign up. It's a full day of events. You get presentations from the Associate Dean of Admissions. You get presentations from other people that are part of the admissions committee of the school. I think obviously impressions, you get to take impressions on each other, which is awesome. It's fun. Very messy as well, but it's a good experience, as you can see in the picture. You get presentations on financial management, and it's basically just a full day of different things. We also have a student panel, so it's just a great way to get introduced to the school and just dental school in general. Okay, what was that?
And then UNC Bridging the Gap. Have you worked with them, Arlette?
Yes.
Okay.
Yes. Bridging the Gap it's a program where you become a mentee to a dental student, and there are 3 or 4 events each semester where you come to the school and you socialize with the dental students. You get to ask questions. We have presentations from Dr. Reside as well, which is the Associate Dean of Admissions. You get the inside scoop of what we look for in terms of personal statements, your extracurriculars, how to prepare for dental school, what you should be doing at different points of your undergraduate career. You get to ask questions about taking a gap year, about being a non-traditional student, anything and everything about dental school. So that's a really good program. And you also get one-on-one time with a dental student. So you can get a little bit more personalized interactions and ask your more specific questions as well.
Okay. Yeah, and we're looking at future collaborations with Pulso as well, so be on the lookout for that.
Mm-hmm.
And if you're interested in coming by the Vidas Esperanza Clinic in Siler City, it's 45 minutes away. Just send either Arlette or me an email, and we'd be happy to have you over, whether it's assisting, interpreting, or just checking out what we do. It's 5 Saturdays a semester.
Mm-hmm. Yeah, that would help you with your volunteer hours and shadowing as well.
So yeah, we can go for the first question.
Yeah.
Do you guys receive PowerPoint/lectures before class, or are they available, or are they only available after they've been recorded? So it varies. It's pretty much comes down to how diligent or how disciplined the professors are. Most of them send their PowerPoint lectures either the day before or the week of, or some of them even just upload all of their PowerPoints at the beginning of the semester. I'm not sure if they're still going to have this when you guys would become dental students, but we do have what are called note takers for each class. So we kind of vote on who the note taker is. They'll take notes of, say, the first lecture, and then the whole class votes, and they will be assigned to take notes for the class the remainder of the semester. And then you would pay them, say, $3-5 for their notes. That's something that I found to be super helpful. So yeah, that's one way of just getting all the PowerPoints uploaded to for you. Did that answer your?
Class,
Yeah, go ahead.
Yeah, I think it depends, like you said, on the professor, on the class. Some classes you have guest lecturers, So it's not the same professor teaching every day. So it depends on that as well. Or it depends on whether they're doing interactive questions and they don't want you to have the answer beforehand. So they'll upload it later, but those resources will be there for you to study after, for sure.
Did that answer your question? You can say yes, thumbs up, or no.
Yeah, I did. Thank you.
Okay, sure. So we have another question. I've been out of undergrad since December 2018, and I'm thinking of finally taking the steps to go into dental school. Didn't bond with your teachers back then, so worried about a third letter of rec. Any suggestions about, or like taking a class at a local college? So if you're not in close contact with, you know, your professors from undergrad, that's totally fine. I would suggest, though, taking a science course, even if it's for a semester, and bonding really well with that professor and hopefully getting a letter out of them. I know some students, or some of my classmates have done that just because they were in the same position as you. So I would for sure recommend that.
Yeah, going into that, make sure that you know, or let them know that you're gonna need a letter early on. Definitely not at the beginning of the semester, but obviously build a relationship with them and let them know before the semester is over that you're gonna need a letter, so that they know. So sometimes, like, even if you want to reach out to an old professor, they'll be willing to do that for you, but they'll like let you know that they want to get to know you before they do that, and you can do that as well. Because I know that when I started asking for letters, I was in an art history major. Most of my classes were 200, 300 people in an auditorium for my science courses. So it was relatively difficult for me to, as a little bit of an introvert, to get a good relationship with all of my professors. So sometimes they'll ask you for your personal statement. They'll ask you to come by their office and talk and get to know you, and they'll write a letter for you. But if you want to go ahead and take a class, I think that's a really good choice.
Yeah. Any follow-up questions with that, or did that pretty much answer it? All right. So another question, if a student is struggling in a class, how easy is it to find a tutor who pays for tutoring? So one thing I really like about our program, or the tutoring program, is that it's an upperclassman that will tutor a lowerclassman. So say a second year took conservative operative dentistry last year, and now they're second year. And they did well in that class, and a first year is struggling with that class. The professor of that class will send out an email to the second years, the upperclassmen, and saying, is anyone willing to tutor a student on this class? So, and since it's another student, it's free. And since the student just took that class a few months ago, everything's still like relatively fresh in their head. And I like the fact that you're being tutored by a peer pretty much. I think it makes it a lot more relatable. Yeah, so it is free. I'm not sure if you don't want to be tutored by someone that's in the dental school, I'm not sure how to go about that. But do you have anything to add, Arlette?
I don't really know exactly how that works. Actually.
Yeah.
I have heard, I do know that it's upperclassmen that are tutors. But I'm pretty sure that you can find tutoring if you needed to, like for like biochemistry, from like the undergraduates. But I definitely think that it's easier to just go with a classmate, like Jonathan said, because they understand how the course works, how the professor kind of structures their exams, what they're looking for. So
yeah,
it's definitely easier and more helpful to go with finding a resource within the school.
Yep. All right. Any other questions?
Is anybody applying this cycle?
Oh.
It's first year 8 to 5 every day. Um, it varies. Sometimes, like for example, last semester we had a gross anatomy dissection lab. So we would be divided into groups, like the class was divided into two groups, and we will alternate. One would go on Tuesdays and one would go on Thursdays. So sometimes, like when you get your schedule, it looks like it's 8 to 5 every day, but sometimes it's not. Sometimes you have free Fridays. So it varies. It depends. Not all classes are mandatory. Everything is lecture captured. So if you want to go home and start studying for a test or study for another class from Friday, then you can do that and then watch lecture capture later that day or another day. It's really up to you. But the only mandatory things I think are just certain classes that professors make it clear that they want you to be there, or labs. Was that
Yeah.
Go ahead, Jonathan.
Yeah, so in third year, our fall, every class was mandatory, but that's because they're clinical courses and they're going through fundamentals of, some more advanced procedures, or they're going through cases, so they typically want you to be there. But especially the first year, yeah, the schedule is more flexible in that courses are not mandatory, or lecture is not mandatory, rather. Any other questions? And we also have our contact information here as well. Feel free to email either of us. We'd be happy to answer your questions.
Well, thank you both so much. Really appreciate it. And thank you for the everyone who attended. We're really happy that hopefully this information was useful for you all. It was really wonderful information as well. So I'm going to share on the chat in case anyone is interested in attending the next week's chat with the School of Medicine. Let me see if I can share that Zoom. Yeah. And anything else from you all? Any final words?
Yeah, just don't be discouraged, like I said, about any of the recommendations or anything. People come from all backgrounds, all different kinds of schools. Some schools some schools might just be more difficult than others in terms of their programs, what they require out of students. So like I said, these are just averages. They're not, meant to, discourage you whatsoever. And if you guys have questions along the way, not just about this specific presentation, you can also send me an email.
Yeah, same goes for me. I don't know if you wanted to say, because I feel like a lot of the time, I think that the most common question that I get is, well, what would you have done differently if you had to apply to dental school again? So I don't know if you would like to give your input on that, Jonathan, before we go.
Me? Let's see. Definitely, keep in mind that you have to get a letter of recommendation from your major and from science. For me, it was kind of like in the back of my mind. So I kind of waited till my very last class of college, which was biochem, to get my science recommendation. So be as proactive as you can in that sense. I didn't do Bridging the Gap, and now that I'm in dental school and see, how great of a program that is, I would highly recommend it. And I think Bridging the Gap is available to non-UNC students as well.
Yeah.
Yeah. Yeah. And don't be afraid to reach out to dental students. When I was in undergrad, I thought, dental students are, super busy. Like they're probably not going to have time to answer my questions, but I don't mind answering questions. And I think I could say that for most of my peers.
Yeah. Yeah. I think that I was always afraid of reaching out. I always had questions or was confused about something. And I never reached out to either the program or the admissions office or a dental student. And I think that would have been a lifesaver for me in several aspects, and saved me a lot of bad times and stress. For me, I think that the one thing that I wish I would have done more was shadowing different specialties and shadowing more. Because I feel like even though I wouldn't have understood a lot of it back then, at least it would have given me a different perspective now and helped me kind of navigate where I want to go after dental school. Because I don't really know much about other things outside of just general dentistry and oral surgery that I was exposed to as a pre-dent. So if you can do that, shadow a variety of different specialties within dentistry, I think that would be helpful for you.
We had a request to show the emails again, so here they are.
Okay.
All right, well, thank you so much. Thank you everyone for attending, and have a good rest of your week. Stay safe, stay healthy. And yeah, until next time, thank you.